Make sure that you sign in at the table. You should see the sign in QR code. Make sure you do that. This is how we capture everyone's participation. So go ahead and scan that QR code to register and sign in for me. Like I said, we are recording. Mr. Al is up front and we are recording this meeting. We're actually doing a hybrid today because some members of our community were not able to make it here in person. So welcome to those who are online, who are viewing us and participating in our meeting today. This is our outline of our agenda of the information that we will be engaging with today. So take a look. We're going to be doing our introductions and of our best start and our vision. We're going to do what we call our community connection. So you're going to have to get to know your neighbors. If you're not sitting at a table with someone, you'll have to reach over and touch somebody. Okay? We're going to have our updates for our partnership from December. Just an acknowledgement for our Black History Month, our community engagement, project updates, policy, sustainability, and capacity building. So just for sake of review, we want to make sure that this stays in the forefront of your thought. Our best start AV vision is we look to build collaborations to support a flourishing communities. So our values are very central. These are things that we came up with within our best start. You all came up with these. Compassion, respect, communication, integrity, important, and acceptance. Our desired results by the end of this meeting, we want to make sure you make connections, get to know one another, make a new friend, understand the partnerships, the new focus. We are going to be going over what is the new focus, the pivot, housing insecurity and poverty alleviation. We're also going to learn about the progress of each of our community change agenda projects. So remember, we were talking about our project and what we were looking to do at our last meeting, and that was in December, and things that have happened since then. And then we're going to look to develop a stronger understanding of our new focus areas and purposes behind the transition. So for our meeting agreements, I'm going to ask one of our welcome committee members to come and read the agreements for me, if they don't mind. Ms. Tess, would you mind reading that for me, please? Thank you, Ms. Tess.
English. Good morning, everyone. Good morning. Meeting agreement. Be punctual. Stay present and engaged and on topic. Put the focus on the future. Be authentic yourself. One person speaks at a time. Agree to disagree. Respectfully. Finish your sentence, not your paragraph. Step up, step back. Exercise confidentiality when necessary. Be patient and open to the technology. Assume positive intentions. A rainy day will make flowers. Separate person from the road. Be active and have fun.
Yeah, thank you, Ms. Tess. Thank you so much. Also, I don't know if I mentioned it, but we do have Spanish interpreters in the rear. So if you're in need of Espanol interpretation, wave your hand, ladies.
Si necesitan interpretación en español, aquí estamos en la parte de atrás, levanten su mano y le proporcionamos el equipo. Gracias.
Thank you. And we also have that online, so hopefully they heard that online. We have interpretation online. Yeah. See? So now is the time that we get to know one another. This is what we call our community connection. So what I want you to do is make a friend. Pair up with two at a table, two or, if it's four at a quad, just pair up with one other person and tell that one person, y'all share, something that you did this week that you're proud of. that you're proud of. We're a Thursday. What did you do this last week that you are proud of? Share it with the person, and we're going to give you like a couple of minutes to do that. And then when we come back, I want you, first of all, ask their name. Don't ask them to spill the tea. Just give them something they're proud of. You know what I'm saying? Get their name. One thing that you are proud of that you did this one week. And then when we come back, share with the group in one word, one sentence, just one sentence. Well, this is Denise, and she said she was proud of blah, 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 blah. She learned how to do a Zoom meeting. So, I know this because I know Denise, and that's what she's proud of. But I want you to pair up. Do that now, and I'm going to give you at least 3 to 4 minutes to do that. Get to know someone that you don't know, that you didn't come with, came with, don't ask. I know you guys are talking. Go ahead.
So,
Right? Make sure your partner or the people you shared with, because you're gonna introduce them, okay? And the one thing that they were proud of that they did. Also, for those viewing us that are online in our Zooms, I do want to make sure that those who are viewing us on our Zoom, it is for viewing only, so you won't be able to engage and ask questions. You can hear us, but we can't hear you, so it's for viewing. But if you have any questions that come up during our presentation, you can feel free to reach out and email the Best Start team. All right? So I'm gonna start with one of my favorites. I'm gonna start with Betta. So introduce, yes. Hello.
I'm Elena.
Hold on.
Everyone, good morning. I'm Elena. I'm here with the Wildflower Project. We're a nonprofit here in Palmdale, and we provide health and wellness services for children with free events. Everything I'm proud of is just making new connections with the community and sharing our service.
So, okay, Betta, did you want to introduce somebody?
So just
Oh, just you? Okay, okay. So my name is Roberto. Other side here. My name is growing. Wasn't really planning on, but what I'm proud of, right, put it aside. What I am proud of is the friend of mine, right, education. Very thankful, very thankful for more opportunities, more growth. Awesome. Awesome. Okay, I want you to introduce your partner, one sentence, and say what they're proud of.
Okay, I have two partners. To my left here, I have Taylor. Taylor is from ABPH and she works with the relative caregivers. And she is also honing her relationship with her partner's family. So she is very proud of that. My other partner is Denise. And we all know Denise, but Denise is doing a plethora of things. But I'm very excited about her getting back into learning baby sign language and also the nutrition for the pregnant moms, which I hope to talk to her to work with her because I work with pregnant moms. So yeah, that's
Oh, okay. You guys are getting it. You're getting it. Okay, I'm gonna come to you. Introduce your partner. No.
Good morning, everybody. My name is Sulema. I'm from the ABP as well. And I met with Ted. What she really enjoys is doing volunteer hours in our community, which I think is very important. And she was very proud that she got to sing. And she made people laugh and have fun.
Awesome, awesome. Okay, I'm gonna move it along. Come on over here, lady. Introduce your partner. Tell me one thing that they were proud of they did this week.
Okay. Good morning, everybody. My name is Alma Manriquez, and I got the privilege of speaking to Lois from CCRC. And one of the things that she was most proud of is being able to start her health journey and getting on the treadmill this morning.
I have one of those. It's just taking up space and getting dust. Oh, okay.
Okay, hi, my name is Lois. I am from CCRC Home Visiting Department, and I had the pleasure of meeting Alma, and Alma is proud that she went to the dentist.
Good morning, everyone. My name is Cynthia. I'm also from CCRC, and I had the pleasure of meeting with Delmy. And she's proud of herself because she completed an event, and it was exhausting that she completed it. So,
Okay, and I didn't get everybody, but we're gonna move along. But do you know why we do this, right? Because we're working as a community. We need to know who's in the room. You need to know who we are working with and for because we all live in the Antelope Valley. And so we're gonna move on. And I'm gonna have my coworker, David, come and he's gonna share some our meeting. Okay.
Right. So I wanted to. Good morning, by the way, everybody. I wanted to just go over very quickly what we went over last time. For those who maybe didn't have the chance to come by in our last partnership meeting, catch you guys up with where we were last. Last time we highlighted the capacity building efforts of our partnership. So back in December, we reviewed our nurturing relationships workshop. Of course, this is held by our very own Patty Enriquez. We also had our parent info sessions as well. These were hosted by SLEA Therapies and Youth with a Purpose. It was parent info sessions providing parenting education and learning opportunities. We also had our Playgroup Academy updates as well. Of course, that's hosted by Darrell and her lovely parent facilitators. And on top of that, we went over our involvement with the All for Kids food drive as well. We also went over our first 5LA strategic plan implementation. So I know that for our last meeting, we introduced housing and poverty alleviation as a priority within the Best Start network or within the partnership. And so we wanted to give you guys data in regards to that. We wanted to give you guys data and policy updates in regards to that. We wanted to start that conversation because our funders First 5LA are seeking alignment, and we want to make sure that our community is informed and with us as we continue to pursue those priorities. And on top of that, we also provided our CCA updates. You guys are going to see some further ones, but we provided where we were back in December. And on top of that, we also had our December celebration of the end of the year. And now I'll pass this back to Darrell, and we're going to be going over a couple of pictures of those holiday celebrations and to acknowledge Black History Month.
So we had a great time for our holiday. Seems like December came and went so quickly. And we are already in February. So I'm going to ask David if you would stop. This is the time that we acknowledge the month of February as Black History Month. And as a tribute to that, we just have a short video that we'd like to share with you.
So why do we celebrate Black History Month here in the U.S.? Well, in the words of former President Gerald Ford, to honor the too often neglected accomplishments of Black Americans in every area of endeavor throughout our history. But what does that mean? To understand it, I'll have to give you the backstory. Black History Month actually started as a week. Historian Carter Woodson came up with Negro History Week in 1926. It came after he noticed most history textbooks largely ignored Black American contributions beyond Harriet Tubman and slavery. The first celebrations were held the second week of February because it coincided with both President Abraham Lincoln and Frederick Douglass's birthdays. They highlighted Black accomplishments, important faces, and the role African Americans played in building this country. The first year was a success and it grew from there. In 1970, students at Kent State University decided they wanted to take it up a notch. They expanded the celebration through the whole month of February. 6 years later, during America's bicentennial, Black History Month became official. Today, it's grown beyond just a focus on Black curriculum in schools. The media, communities, even brands use the month to celebrate Black contributions, history, and unsung heroes. With the Y, I'm Janelle Ford for H-Town Rush.
All right. So that is why we celebrate, a short speech, why we celebrate Black History Month. Next, we're going to have ABPH. I'm going to have Lizette come up and she's going to give you some highlights of what's been going on with our local network supporters, our LNC. And she's going to share what we've been doing out in the community.
Good morning, everyone. Good morning. Okay, so it has been a little slow with events because it's fall, the holidays, but ABPH was able to be a part of 19 community events from our last partnership meeting. And of those events, I was able to attend. We have been showing Best Start flyers in different lobbies like Rick, Wesley, Bart's, and the Women and Infants Pavilion. And we also hosted a community event last Friday. We were able to see some familiar faces, but we were also able to welcome new people to our event. So it was a really nice event. Here's some of the pictures that we were able to share with you guys from that event. And up on the top is the pictures of the other community event with the ABPH staff.
Thank you. Thank you, Lizette. Next, I'm going to have Jennifer Aguilar come up. And she's from the Welcome Committee. She's going to share some information from the Welcome Committee and what they have been doing in the Antelope Valley. Jennifer, she here? I thought she was here. No, maybe she went to the. Maybe she did. Did anyone go to the? You didn't see her? Okay. Well, I will stand in. Are there any other Welcome Committee members here? No? Okay. No worries. I will go ahead and give an update on what's been happening with our Welcome Committee that have been working really hand in hand with ABPH. So the meetings for the Welcome Committee, they gather on the first Thursdays of every month at 10 a.m. here at our office. And sometimes they're meeting in the community now. So they're really emphasizing the renewal of membership forms. At our last meeting, we talked about, they talked about the importance of renewing the membership forms for those who want to be a part of Best Start. We had those forms before, so they're looking to renew those. Out of 27 members that have filled out the forms, only seven people have completed their renewal. So the Welcome Committee is really emphasizing that the importance of renewing those forms. So some of the recent activities that they have taken a part of are two Welcome Committee members attended the Let's Connect event that was in the Antelope Valley. They shared information about Best Start and upcoming events. Their ongoing efforts include continue welcoming new members, community members, into Best Start. So they're really actively out there letting our Antelope Valley neighbors know, hey, Best Start is here in the Antelope Valley. You should come be a part. This is what we are emphasizing. This is our focus. Family 0 to 5, come be a part, let your voice be heard. They're also doing a call. They're calling individuals who registered as first-time members. So they're doing calls. They're going out into the community. They're participating in resource fairs. They provide follow-up support and address any questions that our community members might have concerning Best Start. The next update, our community change agenda projects. Oh my goodness, and we have a few of those who are part of the projects. I know I see a few here. Some are online. I know that. I see Denise is here, and a few others are here. So I'm going to start with our community engagement and educators. Are there any educators that went through the training with Miss Gloria? Denise, come on, Denise. I knew I saw, I was looking around like, where's she at? Come on, Denise.
Hi, good morning. My name is Denise. I was one of the educators that went through the training with Gloria. So we just have some updates and information about that. We are excited to share that our child care educators and promotoras continue to make meaningful progress in connecting families with resources about childcare. We successfully completed 2 childcare information sessions, one hosted with SLEA therapies and the other hosted by Youth with a Purpose. We provide families with information on early childcare options, costs, and enrollment. Moving forward, we will continue to share information, resources throughout the community, and with our partners like LA Care, the YMCA, and Child Care Family Resources. We also remain committed to increasing awareness, building relationships, and ensuring families have access to support that they need. Here are a couple of updates or the summary of the info sessions that we've conducted and the parents that we've outreached to. So we've outreached to a total of 115 parents through this outreach. For our English-speaking educators, there are 66 parents, and for our Spanish-speaking promotoras, there's 49 parents. And of the 115 parents that we reach, 83 parents have children ages 0 to 5, and 36 parents are currently in need of childcare in the Antelope Valley. We will continue informing and supporting our community through these outreach efforts, and we noticed that one of the challenges while outreaching was that some parents are a little bit hesitant to provide their contact information because of the current circumstances, which is completely understandable.
Thank you so much, Denise. So, yeah, thank you, Kira. Our community educators are working really hard. They completed their training, and they're really out there going to events and getting parents information. So I want to thank them. Also, the child care business curriculum, and I'm going to ask Ms. Denise to come up because she was a part of facilitating and development of this curriculum and helping train some of the educators that went through this with us. So, yeah. Come on over here. We said way back over there. I almost called her sister Denise. Okay. I have to remember where are we? We have various relationships. Yeah. So, as the best start, we successfully delivered a 4-week business training curriculum to our community educators, which consisted of 9 modules. And in those 9 modules, it was covering essential business components necessary for community members who expressed an interest and who wanted to open up their own home daycare or child care center. It was we have four. Miss Jadena, Miss Jan, who owns her business. Miss Jadena works at one, and then Denise and Miss Day Youssef, Dr. Day Youssef, helped put the curriculum together, did the training. Unfortunately, one of our challenges was the timing of the training because not all of the educators were able to attend our business curriculum training. But 2 of them were able to complete. I think Daisy's online, she completed, and Denise completed. So we had a time where we feel like, okay, well, how do we get more of the educators to complete the business component of that curriculum? So we're revisiting that, but those were some of the challenges. The 9 modules were very good. They were well put together. So we're looking at making sure that all of the educators can come back to that. Is there something you want to add about the training?
The only thing I would say is I really think that it was very beneficial to the people that were there. They learned things that they didn't know. And even in the process, I learned a few things that I didn't know. So it's very beneficial for everybody to understand what goes into it and to understand what our child care workers deal with on a regular basis. And as far as their finances and being able to take care of our children properly. So it's really something that we need to advocate for is for our child care workers so that they do have what they need and they don't have to reach into their own pockets, which oftentimes they do. Yeah. And that's what I think is really important out of the whole thing.
Yeah. Thank you. So we're going to move on to our policy advocacy, and I'm going to have Stephanie come up and she's going to share information on that.
Hi everyone, I just wanted to give you guys an update on the CCA projects regarding policy and advocacy. Like David mentioned in December, we did go over how the policy did finish their advocacy workshop. And that advocacy workshop was really tailored to early childhood education and how to advocate for early childhood education. So now moving forward to this year, what we're doing is now establishing a fellowship of 10 parents for children ages 0 to 5. And what would that fellowship do is they will start exploring or learning about local efforts that are addressing housing and poverty here in the AV. As you guys heard in the beginning as well, that David mentioned, we're shifting our focus a little to housing and poverty, and also with the ECE included. And then what the fellowship will do is then team up with the policy committee and work together hand in hand and having to build up their capacity on the skills and engaging with and advocating with local officials. So they're able to speak to our local officials about the problems and what trends we're seeing, in hopes that we then put that advocacy into practice at a local level, again, with engaging directly with local officials. So them being able to speak to our local officials face to face, really letting them know what's happening here in the AV regarding, again, housing, poverty, and early childhood education. So that is the update on the policy advocacy for the CCA. I am going to move forward and then talk about our childcare resource hubs. So again, SLA Therapies, they hosted a development workshop for childcare providers in October. And what that workshop really was about was early intervention services. And then we had Youth with Purpose. They hosted a professional development workshop in January, and this one was tailored to diversity, equity, and inclusion. Our next workshop will be with HANA Center. So just stay tuned, subscribe to our email blast to really know what the date will be and the topic that they're offering for childcare providers. Like was mentioned before, like the needs, we need to make sure we're uplifting our childcare providers and we're helping them equip their advocacy skills, but as well as what they're in need of in the community. So that's the update regarding this, our childcare resource hubs. Again, it's SLEA Therapy, Youth with a Purpose, and then Ohana Center. So now I'm going to pass it on to David. Yes, and he'll tell you the updates of data.
Thank you, Stephanie. So, cool. Hello. Okay. But yeah, so I wanted to give you guys a pretty big update on our data project. So as you guys might be aware of, those of you who are new or haven't been here in a while might not, we have been working on supporting our childcare providers' needs by conducting a childcare provider needs assessment. So we conducted that, and we actually have final results. We are unfortunately one of our committee members, Laura, wasn't able to join today, so I'll just be talking in her stead. I wanted to give a thank you first before I go into this to those individuals who contributed to this project directly as a committee, and that is Laura Vermont, Denise Patek, Alberto was able to provide input, Cari Enriquez, and Kelly Timmons. So thank you to those. I also wanted to share with everybody the full survey responses. So if you guys would like to take a picture of that, that is the QR code. You're going to be able to access all of the survey items. So those who might have seen the assessment, maybe you took it, you'll know that it was a pretty long survey. It was around 34 questions. So today I wanted to go over a little bit of questions. I didn't want to take up too much of our time, but I did want to make this available to anybody who is interested in looking at that data. So I'll keep that up for just a second. So I'll go into just kind of talking about our roadmap with this project. So the way that this project started was that in July and August, we needed to establish the context of this. Why is that we're doing this? You know, what is a needs assessment at all? And how can our members feel comfortable in taking part in designing and implementing the survey? So within those beginning months, we went into capacity building around being comfortable with looking at data, being hands-on, implementing a survey, what makes a good survey question, and defining a needs assessment. Next, after that context was set, we went into actually drafting the needs assessment questions themselves. So the needs assessment questions went over around 3 rounds of drafting, revising, improving questions, in that we wanted to see what was most relevant to a provider and what was most relevant data to capture to share with our partnership. So within September and October, we looked at other instances of individuals providing a needs assessment for providers specifically, which was pretty hard because usually needs assessments go to the recipients of childcare as opposed to the providers themselves. So we created those questions, we looked at existing literature, and then from there, we were able to get into November's final review of that assessment. And right there was a key point because we needed to develop an outreach strategy. It wouldn't be very good if we did all this work and context setting if we didn't have a way to actually reach our childcare providers. So we set a goal for ourselves. We said, hey, we need to hit, if we want this data to be viable, feasible, to have some sort of pattern that can carry weight to it. Of course, this isn't going to be a population level survey or study. This is going to be looking at our best start providers or Antelope Valley providers and seeing what it is that they need in particular. So we developed an outreach strategy in which we created flyers. We looked at our database of emails and contacts in which we were able to connect to any providers that we could talk to. For example, at our patent SIP that we conducted, as I mentioned earlier, we were able to share this with them directly. And so we got a total of 34 responses, so which we met our goal. And that was sent out in December. Last month, within January, we needed to do something with all that data, and we wanted to make sense of it. So our last January, data committee meeting, we were able to look at the report of all of the survey responses that we captured and make insights out of that. So I'll move on to the next slide. To give you guys a little bit of context also on how we got individuals to, maybe feel compensated for their time. But like I said, this is a long survey. It was like 34 questions. Some of them were really tough questions as well, like talking about finances, talking about what you want in terms of advocacy. So we wanted to provide an incentive. I would have loved to be able to provide something for everybody that took it, but we did best with what we had. So we had raffle incentives in there. Our first one was creative curriculum set. We had classroom set marker boxes, a safety set, classroom folding seats. You guys can see them right there. So that's our safety set. They have leading ropes in case of an emergency so children can have a safe way to evacuate. And we also have these little folding seats. So with that in mind, I wanted to share with you guys a little bit of this data. So we had demographics that we captured. And the first one was in sharing the provider role. So we had individuals that identified themselves as a babysitter or nanny, those that identified as a family child care provider that is licensed, a licensed center director or owner of their business, a relative or a friend caregiver. Again, this was going out to anybody that cares for children that aren't their own. And we had some individuals who represented mobile child care businesses and a family child care home provider that is unlicensed. So the biggest one that we got, the biggest demographic that answered was our licensed family child care home providers. In terms of race and ethnicity, most of the individuals that responded were Hispanic or Latino. While we had other, we had other individuals that were Black or African American, white, Caucasian, and Armenian. In terms of the age group, the largest age group for child care providers within the Antelope Valley that responded were 45 to 54 years range. We had 55 to 64 as a considerable one, 65 and older, and then we had 25 to 34 as the lowest there. 18 to 24 and 34 to 44 ranges were the most minimal. Right, and so now I wanted to get into the vulnerability index that we created. Now, as I mentioned, this is a lot of data to go through, and it would have taken a lot of time, maybe like a whole hour to go through everything. So I wanted to give you guys a really a good way to look at this data from a general perspective. And so what we did is that we created a vulnerability index. So we had 5 indicators. We had major financial problems, no paid sick leave, delayed medical care, reporting frequent stress, and difficulty paying at least one basic need as indicators that we captured with the child care provider needs assessment. And so when we go over here to this table, we're looking at those risk categories. So the first one is we're looking at how many individuals responded in high. So that is 4 to 5 indicators that they indicated. And the number of providers is 5 that responded there. That accounted for 15.2% of those that responded. Those that responded to a moderate category were the absolute highest. That was at 21. So again, this is 2 to 3 indicators that they mentioned that they're reporting in terms of delayed healthcare, major financial problems. we had 6 individuals that had only one stress indicator, and then we had only one individual here with minimal, as in they didn't indicate any sort of problem. Now, what does that look like? In asking for no paid sick leave, we asked if the providers had any sort of plan to take a day off, if they were paid for that, they were compensated, and 73% said that they do not. So 70% of those that responded to our survey said that they do not have any sort of form of paid sick leave. 85% had difficulty paying needs. And now this data point was really interesting because this was calculated based on a varying range of responses that indicated debt, that indicated having to sell things to continue going, having to use a credit card continuously. So 85%, and this is the alarming one, mentioned that they are in debt in operating their business. 36% indicated that they delayed medical care. So those are individuals that we asked if they felt like they had some sort of health issue that they knew of, but due to their work, they couldn't go and go to the clinic or find an appointment time. 36% reported frequent stress, and that was on the highest range. We had some that had moderate stress, mild stress, no stress. This was frequent stress. So more than a third of those that responded indicated the highest indicator of stress. And then we had 18% indicate major financial problems. And that again was on a scale of, major problems, minor problems, and 18% indicated the strongest of major. The next piece that I wanted to share with you guys was to kind of move beyond the doom and gloom of that. I didn't want to make it to which we feel like this is just bad news. We also wanted to capture their voices as well, because we didn't want all this work to be grounded in just numbers. So when we asked the individuals, and those who were able to access the QR code, you'll see the actual responses themselves. But what we did is that we coded it as well. So all the responses were coded into something, and the biggest one was sustainable funding and fair compensation is in the biggest thing that our providers want our policymakers to understand. So that means a need for higher reimbursement rates, better pay to reflect the cost of care, and financial sustainability for small programs. The next highest coding that we got was reducing administrative burden. So that looked like making licensing requirements easier, paperwork easier, and simplifying the regulations process. And the third highest code that we got was recognition of the workforce. So that is providers wanting policymakers to understand that childcare is essential infrastructure. Their work is emotionally and financially demanding. And on top of that, something that isn't in there is that childcare as a profession is a profession. It's not something that is seen as, just babysitters or nannies. That's verbatim to one of the responses that we got. But it's skilled work. You have to get an education for it. You have to understand how to work with children, how to communicate with parents, and that this work isn't taken for granted. So to share with you all, if you guys want to continue in this work in assisting our providers and reintegrating them into our community, we also wanted to add a couple of questions there that asked those questions. So what providers needed to attend, and they responded with stipends and virtual meeting options, childcare being provided during meetings, and help with transportation. So that is what they indicated were the biggest things that they wanted as a support to attend meetings. And the last thing I wanted to share with you all is their preferred meeting times. Now, this is a big, scary chart, but I'll make it easy for you guys. Purple means morning. Afternoon means right here, pink. And evening right there is salmon, I guess. The night is yellow. The highest indication is in mornings, and the biggest one, 32%, about a third of those that responded, said that Saturday mornings are a great time to meet. And then, funnily enough, nobody wants to meet on a Saturday night. But yeah, I'll let that ruminate for a little bit. But these are basically the times that they felt most comfortable in attending. Now, this again isn't this is not unduplicated. If somebody responded with the times that they were comfortable with, they would just put it down. So if these responses, this doesn't add up to like 30 something, it adds up to more. So just putting that out there. But yeah, so that's the needs assessment in a nutshell. I highly encourage you guys to go back to the QR code if you haven't, when we share this meeting, so that you guys can see the full range of that. Yeah. Yeah, and now we're going to move on to.
I'm gonna move from the QR code. Does anybody else still need it or? Okay. All right, so I just want to give you guys some policy updates regarding housing, what's happening at a federal level, at a state level. So I'm gonna go ahead and show you guys this chart. So here's some housing and poverty bills that are currently in progress. So we have AB 1276. This is Juan Carrillo. So this is our assembly member that's representing us here in the AB. One of the assembly members that are representing us here in AB. So the purpose of this bill, this will help make it easier and faster to build new homes for families with low and very low or moderate income. So what is really preventing is cities or counties from creating confusing or changing rules that slow down housing projects after developers have already applied. So what is it? Oh, and right now the status of the bill is at appropriations. And so what does that mean? The Senate appropriations, the bill is being reviewed to make sure it's affordable. And since it is having, with the cost, so they are they're reviewing the budget and making sure that it can move forward. So why is this important to the AV? It will make more affordable houses faster. So there's not a delay so that we can help families 0 to 5 be able to be home in these new housing that will be developed. And why does it matter with families with children 0 to 5? We know that it's very important that a child 0 to 5 have a stable home because these are the critical years of their development. So without a stable home, how are they going to be able to, be successful in the long run? So, and then just moving forward, there's another bill, AB 1710. This is, again, Juan Carrillo. And then this one is similar to 1276, but this law will prevent cities from blocking or delaying affordable housing by changing rules mid-process. So the first one, again, it's that, let's envision it like this. The housing or the project has not been developed yet, but there's delays because the city are saying, well, you need this, you need this, you need that. This one, AB 1710, is that it's already in progress. So the building, let's just imagine, the building is in progress already, but the cities are putting more of the delay, like, well, this doesn't seem right. You need to fix this, you need to fix that, and disregarding everything that they already approved in the beginning. So again, this is making a delay in the housing that are being developed here in, hopefully in the AB. So it's to, again, make the housing, more housing, not only affordable housing, but make it faster because we know that the AB is growing and it's growing really fast and we need the housing out here in the AB. The status of this bill is assembly pending referral. So what does that mean? The bill is waiting to be assigned to assembly committee to review it. So again, they sound similar, but they're completely different and they're in completely different statuses right now. So then moving on, there's SB 11. So this is Assembly Member Alex Lee. He is a representative of the 24th District. And this one is the Social Housing Act. So what is the Social Housing Act? It's to create affordable housing for families with different income levels. So people living in these homes will have a voice in how their communities are run and can choose between renting or a long-term ownership option. So the goal, again, is to help more families have a safe home, close to transit, and without spending too much on rent. Again, purpose, affordable housing. So, and then the status of this bill is, let me double check. Oh, that's wrong. So it's in the Senate Housing. The bill is being reviewed right now by the Senate committee that focuses on the housing issues before it can move forward to the full Senate. So then now moving on, there's SB 18. So this one is from Blanca Rubio, again, representative of the 48th district. So this one gears more towards poverty alleviation. So it will be a state program that gives money to either grocery stores so they can open or improve stores in areas where people have limited access to healthy food. The purpose of this is to reduce food deserts and improve nutrition, but it depends on the state funding, of course, and it's set to expire. So if it starts, it's set to expire in 2030. So the way I envision it is like, let's think about it in the AV, where we know that Little Rock, Lake LA, they don't have so many options to go out to the grocery stores to buy their groceries. So this bill will help build more grocery stores out there that they're getting the proper nutrition. Again, for families with children 0 to 5, this is very beneficial. This is critical because this is the ages that 0 to 5 are critical ages for development in a child's life. So I wanted to share with you guys these bills that are currently in progress in hopes that I could give you guys an update the next time we meet of where these bills are at. Leave this up here for a little bit. And then moving forward, so what is happening right now at the federal level regarding immigration that you guys in the community should be aware of? So we all know what's happening right now, not only in the AV, but all across, the United States. There's a lot happening. And last year, Trump did sign into law the HR 1 bill. The bill is making deep cuts into healthcare and food assistance that help family, obviously meet ends meet. This bill, well, looking into the California Budget and Policy Center, they created a timeline of the cuts that are currently happening right now to Medi-Cal and CalFresh at a state and federal level. And I wanted to share with you guys that right here, as you guys see on April 1st, 2026, CalFresh will be impacted because it will eliminate CalFresh food assistance for lawfully present immigrants. So the big impact that will happen is that we will see 74,000 immigrants lose access to CalFresh. And again, just want to highlight lawfully present immigrants. So want to highlight that and really make that, it's important that we as a community are aware of this and we spread the word and letting others know. If you guys see this QR code right here, the Budget and Policy Center did create a timeline, not only focusing on CalFresh again, but also Medi-Cal and the timeline of what is happening and what is going to happen. The policy changes that are going to happen and how is it going to impact Californians that are not only on Medi-Cal, but on CalFresh assistance as well. So that is another thing I wanted to share with you guys. And like I said, the timeline is really great. It will show you guys more detailed, different, it will identify if it's a state level or federal level. So I'll leave that up there for a little bit. So you guys can scan the QR code, see the timeline. Again, this is all from the Policy Center or the California Budget and Policy Center. And moving forward, I wanted to share with you guys lastly some updates on the early childhood education funding freezes that we know that was happening here and what Trump and his administration were going over. So wanting to end this in a good note, hopefully. So Tuesday, February 3rd, the House took final vote to pass federal government funding for the fiscal year of 2026. So this will secure stable funding for childcare and early learning education for the remainder of the fiscal year 2026. So that would end September 30th, 2026. So good thing is that they're going to continue funding. So wanted to end that there for you guys. I don't know if anybody has any questions, comments. If not, I'm gonna go ahead and move forward. to sustainability. I believe. Final one.
Sorry. I was trying to get her attention.
Stephanie, I have a question.
Yes.
Are we trying to get people to, do we need to like call our senators or representatives to have really vote on the housing? Oh, I'm sorry. Yeah. I was just asking if we are encouraged to call our representatives or senators to say we really need this housing bill passed. So are we going to get like a group of people and try to do a campaign?
Yes. So that is why we have the policy committee. So the policy committee so it is a group of people right now, and then the fellowship as well. So in hopes that, I invite you, all of you guys, to join the policy committee so we can speak to our local officials and start at a local level. And then we can move forward and see what are we really requesting and what's happening here in the AD regarding housing and poverty. In the AD, what is our pitch? Because we want to be sure that we're going into, meeting with our local officials and really asking them for something that needs change. Not just letting them know like, hey, we have a housing crisis, the obvious, like we all know that. But what are we asking them to do specifically? So yes, with that being said, the policy committee is meeting the second Tuesday, or no, the second Monday and the last Monday of each month. So I do invite you guys all to join us. Again, in this space, we are working on how to start reaching out and making sure these bills are like being more aware of like the housing bills and what's happening here in PV, as well as our fellowship, preparing our fellowships where they can speak to our local reps. And our local reps hear the voices with families, with children. So yeah, thank you.
Thank you for that great question. Remember the goal here at Best Start is to have the parents lead the work, right? It's our community, and alongside our partners, we're reaching more parents. I like to think of this space of where we come and give the updates, and as you can see, there's a lot of great work going on, and we really would love for all of you to get involved. It's with the intention and the idea of like we're working alongside parents, not just on behalf of parents, right? So we definitely want to give them that support as well. Especially right now, it's at a time where everything is up in the air, right? We don't know how much of the work will be able to continue. A lot of organizations are operating by walking on eggshells, not knowing if they're gonna all of a sudden get a notice of funding cuts. So advocacy right now is more important than ever. There's a lot of great work, but even us here at Best Start, at Alpha Kids Best Start, we're even having to advocate ourselves and say, hey, we need to continue to see this amazing work continue to be funded, especially here in the Antelope Valley, right? So I did want to provide a couple of updates because, again, we're all kind of just in that situation. First 5 LA recently conducted a Best Start reflections and finding reports to identify the successes and challenges of this 15-year investment. So as many of you know, Best Start has been around for 15 years now. I think we're right over that into the 16th year. And what they did was like look back at what has Best Start accomplished in these past 15 years, and what are we looking for in the future? What is the future of Best Start? What does it look like? You can access the report on their website. Oh no, yes, on the website. I have a QR code coming up soon. But they're looking at what is the future of Best Start for a couple of reasons. Number one, over the past 15 years, there has been a change in demographics in the current 5 Best Start communities, right? So it's an investment in 5 identified communities. However, there has been an increase in 0 to 5 population in one of those communities, which is ours. So that's a good thing. We have more children 0 to 5 here in the AD. That is something that, in a sense, works on our side, right? Because that means we need to continue investing in resources for children 0 to 5 because this is where they are living. An interesting thing that we are already doing as Best Start here in the AV is that we are Best Start AV. We are not Best Start only looking out for cities of Palmdale and Lancaster, right? And many of you who come from different organizations, you know very well that our services do not end at city boundary. We go out to Little Rock, we go out to as far as Losona. We look at our rural communities as part of the Antelope Valley. So what this report has shown is that we need to treat the AB as a whole, not just the city limits, right? So that's a good thing. We're kind of one step ahead of the game already, so that's obviously a positive thing. However, outside of those 5 best arts communities, there has been one other identified area that has had a increase in the 0 to 5 population that First 5 LA is currently not targeting through its community's work. So does that mean that they're going to start investing? They're going to include it in maybe some other one of the other already best arts in the area? We don't know, right? That's kind of like what they are working on deciding right now. What about that area that has had an increase of children 0 to 5? There's an additional area, one of the current best art areas that has actually seen a decrease in their population 0 to 5, right? So all of this for First 5 LA is like, are we pouring our investments into the communities that need it the most? They're analyzing those pieces. And part of that is because they have shrinking resources. We know that First 5 LA is funded through Prop 10 tax, which they would refer to as the tobacco tax. Less people smoking means less revenue, means less funds for First 5 LA. You can watch a couple of recordings of the First 5 Board of Commissioners meetings where they really go in depth if you're interested. But the reality is a bit dark. The funds for First 5 LA are pretty small, about 70, if I'm remembering correctly, 70 million. It's not a lot when you look at how much investment is going into each community. And then in addition to that, they obviously First 5 LA doesn't only do Best Art, there's other programs that they are also investing in, right? So while it might sound like a lot, it really isn't, right? Not for if we want to continue this long term. So they are doing a huge analysis of what that work looks like, what that investment all in all looks like. They are also thinking of through an equity lens. Are they targeting those that need it the most? This is really difficult, I think, as a conversation for anyone that has to make decisions of where investments goes, because we know that just about in every corner of the state, families are in need. Unfortunately, when we try to tackle it all, realistically, we may not be achieving much. So they have to be very strategic. And so through this equity lens, they are hoping to target the ones that need it the most. They are developing a equity index tool that they will use to determine how they go about investing moving forward. And then they also want to make sure that there is strategic alignment along all of the programs that they run, right? The community's investment is currently in 5 different Best Arts, 5 different organizations that are all working Best Art sort of in their own way. Each community has different needs, right? That's a good thing. However, when we work together, we work stronger, right? So at the regional level, All 4 Kids is working alongside the other 4 Best Art grantees to meet with or prepare to meet with our legislators as well, to continue to supporting our community when we meet and say, here's what our communities need. And guess what? It's not just in my community, it's in these 5 different communities throughout the LA County where we need it the most. So they would like to find a way to align, not just in our case, Best Art, but all of the work that they're doing as they are servicing families 0 to 5. It puts us in a particular place because we don't know what the future of Best Art looks like as of today, right? We're hoping that as the commissioners continue to meet, as First 5 LA continues to put this information together, then we'll get a better picture. Right now they have given us that heads up as they do year after year that we can expect a cut to our budget. We have been asked to also look at what is Best Start currently sustaining? What are some of our projects? What do we, if they say, you know, you're getting a 50% cut or maybe just a 10% cut, or, you know, like, we're not sure where we stand right now. So if we have to save something of the work that we are currently investing in, what is it that we are going to say, this is essential? This is the face of Best Start. We are also having those conversations internally. However, it is really important that we get our partnership's opinion as well. We need that feedback from you to tell us, hey, if Best Start is going to run in some way, shape, or form in the next year, here's what I want Best Start in my community to look like. So again, this is why we have these conversations. Can we go to the next? You got a point. There you go. I went the wrong way. Okay. So, again, this is kind of like a visual of what the next steps in the work look like. Again, they're using that equity index. They are looking to invest in community-rooted hubs. I just get really happy when we talk about hubs, because it's kind of like an idea that came out of Best Start AV first. This is why we have Youth with a Purpose as a hub, Ohana Center as a hub, SLEA Therapies as a hub. Again, it's how are we partnering with those in our community to ensure that we are reaching more families. If we can reach them here at All for Kids, can we reach them at Youth with a Purpose? Can we reach them at the Ohana Center? Can we reach them at SLEA Therapies? We know that there are many families going in through those doors as well, right? So it's all about working, what do we say, working smarter, not harder, right? So again, we're kind of like one step ahead of the game. We're already doing that. First 5 LA is moving more towards a hubs model. Again, aligning the investments for impact and strengthening partnerships. I did over. So what can we do now as Best Start? I do also want to say that, and I think it's in my next slide, so I'm getting ahead of myself, but the Parent Advisory Board is also part of this conversation, because the Parent Advisory Board is the voice of families 0 to 5. So they have also been invited to participate in this. But First 5 LA is having a Board of Commissioners meeting on March 12th. It's from 1:30 to 4:30. They go over basically everything that First 5 LA is working on. They haven't released the agenda for March 12th, but this February meeting ended on Best Start. They spent about 45 minutes going over the findings. And so I'm hopeful that Best Start will be the first thing on the agenda so that they can continue on that conversation. But, you know, might be in the middle, might be towards the end, not really sure. The scheduled time, however, is from 1:30 to 4:30. The agenda is released 72 hours in advance. So I'm hoping that, you know, at minimum 72 hours in advance, I can maybe provide that information. So if anyone is able to get down there, just provide public comments. Some of the other Best Starts did have a couple of their residents there. So that's really powerful to see parents show up and say, hey, I know that you have to make difficult decisions, but know that this investment in my community has made a difference in my life. Actually, someone actually took their 10-year-old child, and her comment was that she grew up at Best Start. Like, my mom came to Best Start, and guess what? She brought me along. And so to see such a young child empowered and willing to stand up for her community and say, hey, if you need to make some cuts, don't pull out of my community, all right? Because look, I'm here. I'm representing those children who are growing up in my community, and I can tell you that this investment has been a positive impact in my life. So there will be an opportunity to provide public comments on March 12th. You can also attend a sustainability committee meeting to provide input on what we keep, what we can let go, and how do we adapt. Again, in thinking of what are we currently doing? I think my team did a wonderful job in just sharing updates on those different projects. Thank you, Denise, because she is a parent who took a lot of those trainings with other parents, and it's the parents doing the work. That is what Best Start is about, right? So February 25 and 27, both will be via Zoom. I know it's a little bit tricky right now. Everyone is working on something. The weather is not helping. People don't want to come out. I get it. Then we have ICE that is also making it really difficult for communities to feel safe and get involved in some of these conversations. And then on top of that, we have the kiddos who are getting sick left and right, right? So we hear it. It's really difficult. So we're going to try this on Zoom February 25th, 9:30 to 11 a.m. And then February 27th, 12 to 1:30. So it'll be a conversation guided by me. I lost my train of thought because I saw your hand go up. Same conversation in both spaces. So you don't have to attend both, just one. You can attend both. In case you're like, wait, I should have said this the first day. Catch us on the second day. But we'll be on there. Was that was the question. Okay. Same conversation. But I'm trying to like provide different time frames for people, maybe different dates. If you don't catch us in one, you can catch us in the other. Okay. Any other questions? Okay, I keep thinking you're gonna click for me. I'm sorry. Okay, so our parent advisory board did meet yesterday. We looked again at the projects. What has the investment been so far? How many parents have we reached? Specifically, parents 0 to 5. And out of those 5 projects, for them as parents with children 0 to 5, which of the projects made sense that if we had to keep, either expand or figure out a way to make it work, which ones were the projects that we were going to keep? We didn't get through our whole conversation, so the parent advisory board will be meeting a second time to finish up our conversations because there are 3 issues that in the reshaping of Best Start, there will be a focus on housing insecurity, poverty alleviation, and culturally affirming services in early childhood education, which again, you've heard us share a lot about the data on housing insecurity and poverty alleviation. I don't think we've talked too much about culturally affirming services in early childhood education, but we have been doing some work in the back that we're hoping to be able to put together and share soon. I'll just give one example. Stephanie, alongside Jan from Jan's Family Childcare, she was a part of the childcare business coaching. And Shadena from the Ohana Center are currently taking the, participating in the Institute, I'm going to botch the name, for Culturally Affirming Services for Black Children. This is through Black ECE, and so our hope is that after participating in this, maybe we can either have Black ECE come out here and do some of the trainings, or we have 3 people in our community who can put something together for our community. So it's still in the works, but just kind of giving you a heads up there. Any questions, comments, concerns in this work? It's a lot, guys. It's a lot. But I think, Best Start is working hard here in our community, and we hope to continue this investment, continue to grow. And again, if anybody is interested in, getting their hands in the work, please consider joining our committees. There's a lot of great work going on. And I really want to thank the parents for staying committed and involved and pouring their heart into this, because I don't think we give parents enough credit, right? Even those days when they don't show up, not because they didn't want to, there's a lot that goes into taking care of kiddos. So we're trying to find ways to make sure that we can always keep parents involved. All right. Yeah, I'm done.
You got. Wow. Great. It's a lot of work going on. It's like, well, we took a break for December, but not really. We worked. And I want to give credit to our community partners because you all were busy. You were right here with us. Like Carla said, many are not here for various reasons, but they have been like sleeves rolled up, boots to the ground, online, creating, participating. So thank you for all of that information. So your voice is so needed in this space. You all are imperative. We want to continue on with our work. So if you were able to scan those QR codes, get on some of those meetings, and then also get in alignment with Stephanie, part of policy. That is vital. I remember last year we took some of the residents who were. Is anyone here that was able to go to Sacramento with us that one year that we went? Yeah, Denise and we went to Sacramento to talk to our legislators and voice some of the concerns and what we saw was needed here in the Antelope Valley for childcare. And we met with some of our representatives. In fact, we were flying from Juan Korea. What kind of same language? He couldn't escape us. He's like, good sir, who are you then? Yeah. So I was like, yeah, don't try to go in first class. I'm right behind. But so next we have coming up some of our learning opportunities that are coming up. First is we have this one currently, but you can still get involved. It's the no, it's full. Okay, correction. It's, no more. It's full. Well, next time. But Anthony Nix went through our trauma informed nonviolent parenting and got certified. And now he's a parent, he's a community member that's teaching it. So the next time it comes around, we'll let you know. Okay? Okay, what about this one? This Denise.
You can definitely register for this one.
You can register for this one.
Yeah.
This is our nutrition for pregnancy and early childhood. This is Miss Denise, and she's going to be conducting this event and teaching February 26th, March 26th, April 23rd, and May 28th. So there are 4 sessions. They're 2 hours. She's nutritionist for parents, expecting parents, and those that have little ones. Learn how to feed your child right, how to eat correctly. It's a nutritional class, and she's an awesome nutritionist. I can give testimony to that one. So it will be in English and in Spanish. If you know anyone, Spanish interpretation, right? Okay, so we will have our Spanish interpreters here. But I think we have flyers for that one over there. So take some flyers, pass them out, invite your community, neighbors, family, friends. Okay. And then nurturing relationships, and that's what Miss Cotty Sanchez, families with your children or expecting, you're invited to connect, play, and learn together during these learning sessions. They will share ideas on how to build strong relationships at home while joining and connecting with other community families and finding positive ways to change. Positive ways to change. So these are things that are offered. And Cotty was also a part of our Best Star partnership and has gone through a multitude of our classes and training and been certified. So I'm excited to see our community coming back and bringing what they have learned, and they're bringing it back to the community. So that's exciting. As we begin to come to the conclusion of it, we make sure you follow us, scan us. You know, we're on Instagram, Linktree, Facebook. But I also want to encourage you. Our team, we have our policy committee. Join the committee. Get involved. Our data committee. David makes data sexy. Don't turn red because I said that. But that's all right. He does like, oh, if he can explain it to me, and I'm like, oh, yeah, I get it. Stephanie is tearing it up with the policy committee. Join a committee, the sustainability committee. We've got to keep going. So how do we make sure that we're able to stay vigilant and viable in the Antelope Valley? You need to be a part of one of these committees. The welcome committee is going out. They're actually boots on the ground. And I'm so excited that they are doing those venues with ABPA. So your part, where can you fit in? Anywhere you can jump in. But we do need you. Miss Tess has been a part of it. Denise has been, and she was with me in my coaching, our child care business, and her and her little one, they were a part of it. And they were getting it. So we need you to be a part of that. Like us on Facebook, share this information, and tell us what you think. Scan that QR code. How do we do? Are we meeting? You got a question? What is it, my friend?
Hello, everyone. My name is Amrocho. I've been I was starting this program way back. Very successful. I'll tell you a little story. No, growing up, right, own policies and committees, have all been a part, has always been welcoming as well, right? There's no resources for autism. Doing the work that we do, right? How we can improve, right? The community can all come together, right? And build, be involved in the developmental disabilities as well, right? The families, right? Respecting, right? How we can all help each other, to advocate, not just for one thing, right? But also advocate for developmental disabilities as well. The government also, and the funding with that as well, is not really up to us, right? So what we can do on our end, right, we can first talk about it, right, advocate it, right, and also really fight for it. So we have to really fight for what we want, for more of the ways we can help our 0 to 5 kids, childcare that have those developmental disabilities, right, giving classes, giving training, getting people more involved, things like that, right? We did have a bad start, right? And we do need to do better. Ultimately, we really need better, right? We need to be able to give each more about it, we need to be able to discuss more about it. Because what I want to do is I want to be able to have a positive life, not just look at all these negative things that have happened, right? Because there has been a lot of negative things, and I want to do better. I want to advocate, encourage, educate, right? But what does that mean, right? When we are advocating, what does that mean? We're empowering families, we're supporting those families, right? So the APPA, the 0 to 5 program and all those things, right? What can they do? They can advocate, educate, encourage, right? So I want to support her in this as well, right? How do we do this as well? We can come together as a united front, giving those classes, right? So CR, so coming in here together, right? That is how we can then do that, to become successful, right? We become a leadership, we become that united front that we all need, right? Right. And we want to have that respect as well, right? So how do we learn? Right? With this learning in the community, right? Having the training, right? Ultimately become successful, empower us, right? That's what we want. We need to support her, right? But all of us, we need to all be able to support. Some programs have a law of not failed us, right? The money and things like that not failed us. But what can we do to do better, right? And so don't look at it like, oh, the child needs a medication because they are acting right now. They need a resource and they need help.
You heard her. Y'all support me. Well, what I love about this start is the capacity building and listening to a few of us were able. With the baby side. Okay, for everyone in our community, can we get back to our community? Because we all live here in our training class. We have learned everyone has a strength. And as we come to the table, our strength ignites all of us. Well, I might be strong in one area, you might be strong in another area. When we combine our strength, we are a force to be reckoned with, and we can see changes in a positive direction coming our community. So we're learning, how do we work together with what we have that's positive, that's building up, that is encouraging each other, but also utilizing our strengths, right, Ted? And then we make it work together. So thank you, Mr. Bedwell. Okay. All right. Well, I believe we have lunch. See, we know how to get you here. We feed you to Apollo. No. Yes, please meet someone you didn't come in with. Exchange cards, numbers, names. What do? Talk to someone and then go get you something to eat. Oh, members. Okay, wait a minute. Everybody wave at the Zoom people on Zoom.